Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And we're back. And we're getting ready to move into our first conversation for this morning. We are joined via Skype by Dr. Marvin Manzanero as we get the latest update on COVID-19 and all the work that's happening there. Good morning.
Good morning, Doc.
Good morning.
How are you today?
A little bit better. I think we're gradually moving along, seeing how COVID-19 goes throughout the health systems, not just beyond the COVID-19 topic, that is.
Of course, of course. Are you able to rest a bit better now that we are officially at 2 weeks with no new cases?
Well, this weekend would have been one where you can say you rest, but every time we put in samples, I can't tell you that I rest until those results are out. And I think all those results that came out this weekend, I think we did close to 100 tests Saturday and Sunday. We are all negative, so that's a good thing.
So we're just at a little under 1,000 cases, tests that have been done in Belize. And I want to start there because I think that is perhaps the primary concern for people at this time. What happens in this phase? You've passed 2 weeks, you've done your contact tracing for the positive cases. You said you were going to go back and test secondary contacts. And then you also spoke about doing a sweep for testing. Can you explain to me what will be the new protocol for testing at this point since there are no new positives?
Well, today marks 2 weeks since we made that announcement. So that means this weekend that just went by would have been the 2 weeks that we last swabbed those identified cases. So the first thing is the contacts of those cases that were last identified now have gone 2 weeks.
Yeah.
And so we will need to go back and swab them, the ones that were negative, and the ones that were positive as well, or later on in the week. But the ones that were negative to, in point of fact, determine that they still remain negative. So that's the tricky situation because you will note that most of our cases have been asymptomatic cases. So that's what we would need to go back and do. This weekend would have been the 2 weeks. So this week we start looking out for those that were initially negative to see whether in point of fact they are negative. That's one. Two, all healthcare workers that were exposed, I believe most of them have been swabbed. All of them are negative. The ones that are remaining from patient number 10, those are going to be completed this week. Last week, when we were discussing this with the epidemiology team, we were looking at who else do you go and take a sample from? Because we have done that with people who have influenza-like illnesses. We have done it with people who have SARS, which is severe respiratory. We have swabbed all of them. We have swabbed all those healthcare workers that were ill. So one of the considerations we are thinking is doing frontline personnel. I mean, people who are maybe in immigration, maybe tour guides, and do a randomization sampling because we won't be able to test all. Test people who perhaps have gastrointestinal infections and are showing up in the health system. Some patients outside of Belize have shown up with gastrointestinal symptoms, diarrhea, nausea, vomiting, or even people who just fever, do it at random.
Okay.
That's where we want to move this week because...
So we're officially moving into that phase of testing, or that's to come at a future date?
No. I think that's where we're going to go this week because we are not any flu-like illnesses. I know towards 1 week ago, people were saying, but you're not doing testing. But then the patients who had respiratory symptoms were simply just not showing up there. They're still not showing up in the health system. And the ones who are showing up and are being hospitalized, we are taking swabs from them and they're turning out negative.
How do you address those concerns? How do you address those concerns from the public when they are clamoring and urging the ministry to conduct more tests, but then your responses, as you've mentioned, is that those persons aren't showing up in the system. How do you ease those concerns?
What I think is with communication is having constant communication and people understanding that there is a science behind everything that is being done. We are doing consultation with colleagues with the PAHO office, with CARFA and our fellow CMOs, the chief medical officers of each country. That communication is, I would say, on a constant and on a daily basis, because we are learning as we move along. It's not easy as well that people can just say, this is what needs to happen. There needs to be a specific methodology. Even when you do randomization, understanding that you're not going to be able to test everybody, there's a process of how you will select those patients as you move along, or the potential patients, if you will. So it's trying to understand and trying to explain it to everybody so that they can appreciate where we are going, and ensuring that we are doing the right thing. Even the question we had with fellow colleagues at the CARFA level, English-speaking Caribbean countries, is how many tests do you actually need to do before you can declare that you don't have any real case in a given country. We had that question last week, and I don't know that we have an answer for that as yet.
So let me go back to something, and perhaps you can explain it a bit better. So the contact cases of the last confirmed cases, which is 2 weeks ago, it would be 14 days. However, the quarantine that is recommended is for 21 days, 3 weeks. So if we would be able to get to next week with no new confirmed cases, that would mean that those positive cases didn't transmit the virus to their close contacts. What does that mean for us then?
Yeah, well, 14 days is when you start doing the swab, but what we are noticing is that our patients are not necessarily recovering at day 14, which is why we extended the quarantine to 21 days. That's important that we remember that. In order for us to determine that this current outbreak, and I have to be very clear as to when I say this outbreak, right, because it's the current 18 cases, we will have to go 2 more weeks before we can consider, and that might change even, but that's what the science right now, 2 more weeks to make it for a total of 28 days without a case before you can consider this outbreak seems to have been over. And I'm saying this outbreak because eventually you're going to have, or you can have more waves. It's not going to go away. Even the talks last week with colleagues to think that COVID-19 could potentially be a seasonal one, so that you can have Caribbean countries in a higher number towards the end of the calendar year, because that's when your flu season routinely picks up. That's October, November, December. So you'll have to prepare your health system for that eventually.
Doctor, I think that's a very critical point that we perhaps have to keep on mentioning, that this, even if we continue to see no new cases, this doesn't mean this is our end for COVID-19. But when you look at the risks that we do have in the country, let's use examples of people who are still moving across the border for the issue of trade. We still have exposure taking place outside the country on a regular basis. There are many who believe, Dr. Manzanero, that it's not that we don't have any new cases, it's just that we're not testing enough to find the positive ones. What are your thoughts on this?
Well, again, it could be the issue of asymptomatic carriers, and that can happen just about everywhere. But again, the morbidity, which is what you're concerned about, I mean, the people who are ill, and your mortality, those are the 2 main issues that you're trying to also contain. The further spread, and that you're not having people that are critically ill, and people who are just ill, then so morbidity and mortality. We are not seeing them. Even though you do active finding for those, we are not seeing people who are critically ill inside a hospital. We are not seeing people requiring ventilation or having severe respiratory problems. So even if you may have asymptomatic carriers, and that would be the second ideal. The ideal is that you never have a case. Second ideal is that you may have asymptomatic carriers and nothing happens. I can't even talk now about immunity because the newer evidence is suggesting that there may not be the development of immunity. It would seem that only some literature is talking about 2% only of people exposed develop immunity, which means that you can, for right now, seems that you will be able to get a new case of COVID-19 so that you're never really out of it. And that's a little bit scary when you think about it.
So what does that mean? A person who's been positive before can get reinfected? Is that what you're saying?
Yeah, which means that, that you don't develop immunity, which is one of the notions we always want. You want people to eventually, that's why you want to go for a vaccine so that you develop levels of immunity. But people who have been infected seems that they are getting reinfected, so that would mean that you don't develop immunity. We are considering also going into the month of May, perhaps doing antibody testing in our population. Do it in tandem with the PCR testing that we are doing, so that we can try to determine whether people have developed immunity in Belize.
We've received antibody tests?
No, we are looking at that for the month of May.
Okay. So we may potentially source some and start testing people to see if they've been exposed, because that's what the test does, right?
Yeah, once we have an approved test by FDA and WHO, then that's something that we can consider as a parallel study, if you will, because you won't be able to move away from PCR right now. So it would be antibody testing plus PCR. So and PCR, the antibody testing will require blood to be drawn. So it's two tests that you have to do.
Where are we in terms of procurements at this point in time for medical equipment and supplies relative to the fight against COVID-19? We're talking reagents, we're talking everything that we need in terms of continuing our battle.
Well, the next batch of ventilators that are due to come in, we hope that that will arrive this week. And we are not using the traditional plane route. I believe those are coming by ship, taking a little bit longer to get here. The same thing with PPEs. We have not been able to get them in country as yet. We had a little bit of a delay in terms of the reagents and our swabs. We routinely would be sending them through Amerijet, but Amerijet didn't come during the week. It arrived, that flight arrived until Saturday. Our swabs were apparently not on that flight. We did not get them. They were apparently confiscated. We're trying to determine what exactly happened to the swabs and trying to find alternative routes for getting it here. The x-rays that were also paid for weeks ago have also not gotten here, and that's the route would be by plane through the US. So we're trying to find alternative routes if we can go through the US. The reagents can get a bit tricky, and I think all Caribbean countries, as I understand from the meeting we had last week, are going through the same process. We have reactions, which is the tests that you are able to do now that was gotten through PAHO, but you still need your enzymes to do extraction of the virus, purification of the virus. So all countries are having difficulty in sourcing those key elements, but for now, we would have to continue doing testing.
Is
Dr.
it of concern?
Manzanero, can we simplify that just a bit? I want to be able to make sure I'm understanding right. So if you don't have swabs, and those are the Q-tip things that they use to collect the samples, right, the long ones, your reagents, which are your enzymes that you add to your kit to be able to determine your reading, what's our status in terms of how many tests we'll be able to effectively execute if we don't have these other tools? How many more tests can we do?
We had 2,500 reactions from PAHO. That's the amount of tests that you are able to do, provided you have everything else. We got 8 extraction enzyme kits on Saturday. I don't know how many were used through this weekend because it's not necessarily a 1-to-1 ratio. So today we'll go back, and every Monday we update our list to see what is needed. It's not that they are also not being procured. You will recall more than a month ago when we had a discussion, we had said we had procured 40 kits of 96 tests. Only 10 of those kits have arrived. 30, that even though they have been paid more than a month ago, have not arrived in Belize as yet.
But, and I think that's a valid point. I think you speak of what's being procured. In other words, you place an order to purchase, but what lands in country, what arrives for us to be able to use is a different story. So it takes me right back to what I'm saying. Even if you receive kits, but you don't have the swabs or the reagents, it means it will limit your capacity to test until these materials arrive. So have you done an analysis to see, okay, we can execute, 500, 200, 1,000 more tests until we get this other equipment? What number are we looking at?
We do that update every Monday. So, I mean, once we start running low, and we did say when the swabs were starting to run low, we have always been looking for other options. We were looking for options in Guatemala, Mexico, through the weekend, because they are not only used for COVID-19. You do swabs to test for other influenza viruses.
Yeah.
Use your enzymes for extraction, doing other PCR tests. So it's not only COVID-19. So even I think it would be wrong for me to also be able to say, okay, we are able to do 800 COVID-19 tests when you're using it for other things. Of course, the priority is still COVID-19, but if your patient is COVID-19 negative, then you still, remember, the parallel of looking for other viruses is important, because if you have H1N1 as well. So even if you're COVID-19 negative, those are being tested for something else. But we update that every month.
Okay, so can you give me
I
an
think we can start
indicator?
socializing.
I know you're being very cautious
Hello?
because the new numbers will be determined today, but can you give me what that number was last Monday?
I don't have it up at the top of my head, Marlene, but I know we were very, very low in terms of extraction enzymes. Reaction kits, we were not having a problem. With swabs, we can go maybe 2-3 more weeks with the swabs we have. PAHO was very clear to us last week, Wednesday, to say that they don't have, and the two sources they have are not able to provide. One company that we had reached out to in a neighboring Central American country said that's off the market right now. We can't provide. So I don't have the numbers. I mean, we can provide that at the end of today to see how many more tests we can do and how many more swabs we can do.
Let me ask you this question then. Is it of concern in terms of the overall messaging? Because while the ministry has been at the forefront in terms of providing timely information, during those statements, either by yourself or by the Prime Minister, there's always talk of procurement of tests and swabs and what have you, but then we're having this difficulty of actually landing them in country, which in a sense kind of gives a sort of a false hope if you're hearing all these numbers, but the true picture is that they're not all getting here in a timely manner. How do you kind of change that narrative to something where it's not as, I don't know, as I'm looking for a word here, so that it's not as misleading, for want of a better word.
Well, this is the first time our swabs did not land. I mean, when they were expected to land, we're going to go and determine where they are today and whether we'll be able to get them from that source. Yeah. So it's the first time that it has not landed. That's one. Two, it's the first time that the flight that was supposed to have brought it from earlier in the week, last week, did not arrive on the Wednesday. Then they told us on Friday, and then they finally said Saturday. So we had not had that experience. We have seen it happen to other countries. We are aware of the shortage everywhere, not just in Belize. But this is the first weekend that something that was scheduled to arrive did not arrive. Mm-hmm. The other ones, we are trying to find mechanisms to get it here. So those have not even taken off from where they're supposed to have taken off from, because we're trying to make sure it gets here. We don't want it to go through the experience that other countries have had where it gets plugged off somewhere else. So we're trying to avoid that. But it's the first time this has happened. So I think we also need to be very clear if by the end of the day we're able to say, okay, this is where it was taken from and this is why it was taken off from us, then we'll be able to say that. But it had not happened to us before.
Okay. Well, we look forward to those numbers because, we understand that testing will continue to be a critical part of understanding our situation. I wanna shift away to another topic, if you'd allow me. One of the most fascinating things over the past few months has been watching all the new research coming out about the novel coronavirus, and this virus just keeps on, not changing, but we just keep on learning new ways of how it affects people and new age groups and new impacts on the body. I know a recent study is saying that young people are suffering from strokes as a result of, and we're talking 20, 30-year-olds, as a result of COVID-19. What do we know? And I know 18 is an impossibly small number to work with, but what do we know based on the experience in Belize so far? What has long been the information first coming out of China was it's elderly and it's high risk. But talk to us about what we can say about our COVID-19 data.
Well, one is that it has affected all age groups, both sexes, in similar fashion, 9 and 9. The two patients that unfortunately died had underlying conditions. That's one. Two is they were people, two males older than 55. And the vast amount of our patients did not actually require in-hospital stay or extensive medications in terms of their recovery.
So
16
of our 18 cases, we had 4 hospitalizations, 2 deaths, and 2 have recovered from the hospital care.
Yes, yes, and 6 have done the full recovery, at least having 2 negatives, and I believe that out of the 10 remaining, at least 5 of those should be recovered throughout the next couple of days, or by the Friday at least. So that will only leave you with 5 active cases. What we do know also is that our cases are not recovering in the 14-day time period. That's why we had extended the quarantine, so people are still having extended recovery times, which is what the literature is starting to describe now. And that's why it's important for us to be able to understand that this is not going to go away so easily, because imagine if you have 18 and you suddenly have 200 people, even if they're not ill, these 200 people that are in either self-isolation, wherever, or in a hospital setting, the long recovery process that you can have before you can be fully cleared. I think that's something we cannot shy away from. As I said, the vast amount of them were detected by swabbing them as initial contacts, not because they're ill. So that's important that our patients are not necessarily showing any sign or symptom.
I'm glad you mentioned that, because that was really another question I wanted to ask. How many of our 18 cases were entirely asymptomatic? They had nothing, not even a sniffle.
I would say about half, if not more. I don't have the exact number, but I mean, understand even the person who was on the quarantine, he was swabbed just because he arrived and was quarantined. We had people, I think it's more than half of them were not really showing any sign or symptom. They just showed up positive because they were swabbed in the mapping exercise. At least 50% of those 18 people.
And the rest that had mild symptoms, what were their most common symptoms?
A little bit of cough, runny nose, headache, not even fever as a primary reason, except the ones, of course, who were in the hospital. But the others were just had very minor flu signs and symptoms. So a couple of them had lost their sense of smell and taste, as described in the literature as well.
Did any have the gastrointestinal symptoms that you spoke about?
One, as I can recall, one.
So I asked those questions because clearly one of the first messages that went out was to look for things like fever and shortness of breath. From what we've heard from some of the positive cases, they haven't had these symptoms. So does that now mean that perhaps when we go out and do expanded testing that we change, given our experience, again, with the very small number of 18, the symptoms that we ask people to look out for, to contact the Ministry of Health? So if I feel a loss of smell or taste, or have unexplained diarrhea or vomiting, maybe then I contact Ministry of Health and say, well, do I need to get tested?
Well, we have tested people who have lost their sense of smell and taste over the last 2 weeks. That has happened. So that was taken in tandem with those who had respiratory symptoms. Those people were tested, and they were negative. The other thing in terms of our experience, because I know there was also a heavy call for having hydroxychloroquine. Chloroquine doesn't seem to work. There's no medication that seems to work right now. So even though it's our interim guidelines, those interim guidelines started the new review process last week, Thursday, and all that section is simply just going to be taken off because it doesn't seem to work. Actually, a study, as we understand it in Brazil, had to be cut short because 7 out of 10 people died. So there's no specific medication right now, and we need to be aware of that. We need to be able to say that, and people need to be able to understand that there might be no specific medication if we are to fall progressively ill.
Yeah. And what does that mean for us in the long term? I mean, Dr. Manzanero, we're looking at the lift of the lockdown. There's an extension in the state of emergency, but we know that we keep on hearing of what is to come in terms of a relaxing of guidelines. What's your perspective on this? Do you think that we're perhaps moving towards increased movement too soon?
Well, as I understand the new SI that was passed out, it doesn't mean that people other than essential workers are going to move or should be moving. I think it's, I heard the word enforcement when we were having discussion before we started discussing the topic. It's more than enforcement, it's people's understanding of where we're going to go with COVID-19, because as I had said on Friday, Saturday, is even if there's a complete relaxation on a Sunday, if you have nothing to do on the street, then don't be out on the street. I mean, it doesn't mean that because everything is kind of opening up, I don't know that we will be able to understand that nothing will be the same. Regardless of where we go to work, the economic situation, everything else, nothing will be the same. And if we have no business on the street, then we don't need to be out on the street. So the relaxation, if you will, it has to be, if you recall how we went about scaling up till we got to a complete lockdown. Yeah. It's the same process that I think would follow, the scaling down, if you will. Now people are concerned about school, for example. When will school be open? That's the last thing on our list. But even so, I mean, this weekend you still have people going to the river. I just saw not people being arrested. You still have people doing big family barbecues and these kinds of things in their own surroundings. So we need to understand that we are not there yet, and I don't know when we'll be there fully. And even if we start to move towards that, well, I think it's a cultural situation to a certain extent. I have said before that I don't know that we are a disciplined enough society. For example, the use of masks, we need to really, you don't wear a mask just because it's trending or because you see everybody wearing it. You need to understand why the mask needs to be worn properly.
Are you now supporting, clearly, you know, we'd asked you before about masks and you said you used the WHO guidelines, which was that only sick people needed to use masks. But we've heard the Prime Minister, now the transport regulations are saying you must use a mask. So what does this mean for your position?
Well, the official PAHO note that we have still doesn't routinely recommend it, because one of the first things they say is the mask. In other countries that you have seen moved, it has been provided in certain aspects, but we need to safeguard first that the masks are available for healthcare workers. Yes. There can be a potential protectionist, but again, that doesn't replace the other elements. That doesn't replace the social distancing, that doesn't replace the hand washing, the avoid touching of your face. The mask is perhaps the fifth mechanism, but it defeats the purpose if you're going to go to the river, for example, or have a barbecue, and you say, oh, I'm wearing a mask, I'm good. I would rather you not have the barbecue and forget the mask. So that's where I think we need to be very careful of ensuring that once it needs to be worn, that people are wearing it properly. So we're going to have to go back.
Let's go back a bit to where you had mentioned earlier that there are cultural considerations to be made here, because when you look at our Belizean society, for instance, you're looking at persons who have large families, persons who find or are accustomed to certain kinds of recreation. Perhaps going to the river is something that families do on Sunday that has become what they would consider normal over these many years. And so the idea of the slightest relaxation of any laws or regulations for them means, okay, well, I could go back now to doing what I was doing before that was part of our family tradition or what have you. Now, how do you curb that against the fact that this new normal, quote unquote, prohibits us from doing these kinds of gatherings going forward?
Well, that's part of the discipline. Let's even use the example of a vaccine then, right? If you will, I mean, 12 years ago we were talking about H1N1. We didn't have the in-country capacity to make the diagnosis.
Yeah.
And people surely died in 2009, 2010 because of H1N1. They still die. There's a vaccine and we still don't use it. The vast amount of Belizeans don't get the flu shot, even though you might do ads and stuff like that. So that's part of cultural norms, if you will. But and that's why I went back to saying we need to understand that there is not going to be the same norm. There is a new normal, and that may mean sacrificing going to the river this year, perhaps. Because when you talk about social distancing, all studies that you review are telling you it's going to be here at least for the next 2 years. So the next time you go to the store, are you going to have to wait your 6 feet in line? That's more than likely where it's going to be. That's going to be the new norm. So I think that's part of the messaging that we need to get across to everybody, that it's not going to be business as usual as long as you have COVID-19.
So I think that's part of what we hold on to, thinking that as we see no new cases, it means that at some point in time we'll say, okay, it's over, let's just go back to life as it was in February. But we hear your message, and this is one being reiterated across the world, that there is no going back to what was before, not right now and not anytime soon. Dr. Manzanero?
But it's the same rhetoric. You see the same people saying, oh, you're not testing enough, and you have them walking around asymptomatic. Okay, that's putting the onus on the Ministry of Health. Yeah. But that same discussion is what we need to then say, okay, if Ministry of Health is not testing and they're all there asymptomatic, then when we're out on the street, you have to assume that all those people we are meeting are the asymptomatic ones. You have to wait for those to be identified. That's the people out there that we are complaining about.
Yeah. Dr. Manzanero, you know, we know that you work closely with the Oversight Committee, with the task force. Is there already a plan in place as to what happens if we detect another case? Or should I say when we detect another case?
Yeah, it depends, because it's not only before it gets to the oversight, we as health need to determine what we need to do, because it changes your testing and all your mapping exercise. First of all, it depends if you identify it where, if it's a new cluster. If it's not associated to the identified cases, then you kind of have a new ball game, if you will. If it's associated to clusters that we had identified, then that's some level of anticipation that could potentially happen. But let's say you identify a case out of the blue in Orange Walk, then you have to go and do a mapping exercise and find out what's going on there. So it really is going to depend on where you find them, when you find them, and what level of association they have to previously identified cases. If it's a new cluster, then it changes completely. And as I understand it, the Oversight Committee is, again, we're meeting on Wednesday. It would change. We give them an update every week to help guide decision making in that regard. That's what it is.
Let me ask you my final question here, Doc. So the government has undertaken this massive exercise to mitigate, in the first instance, the outbreak of coronavirus in Belize. Eventually, we will phase out of all of these measures. But what happens should there be a second wave? Do we see another economic shutdown? Do we see all these stringent measures coming back into force? Or is it going to be dealt with on a district level or a community level? What can we expect in the long run?
Can you have more lockdowns is perhaps the easier question. Yes, you can expect more lockdowns, phased in the same way we have done. Understand that we never transitioned to a stage 2 in our plan.
What
but
does that mean?
I mean, if you recall the plan that we had, where we said imported cases, second would have been localized community transmission, and third would have been extensive human-to-human inter-community transmission, which is a more ongoing transmission like our neighbor Mexico is undergoing right now. We never really transitioned to a phase 2 because we never really had sustained community transmission other than the 2 clusters that we identified. So the transition never really went there, but we took measures as if we were in stage 3, and which is commendable because countries who have gone through this are saying that's perhaps what we should have done very early versus trying to save the economy. Look at what, and again, countries make sovereign decisions. The US, for example, I don't think has gone through a full shutdown in most of, and again, they're in a full phase 3, if you will.
Yeah.
So can we eventually have lockdowns as we move along? Yeah, I mean, it can happen, depends on how extensive your wave is. We might be better prepared as a community, hopefully not just the Ministry of Health, but it requires a community effort. If that is what needs to happen, then that's what needs to happen. That's why we need to start considering how we will go about doing our business under a new norm.
So what you're saying is, with the confirmation of new cases comes the potential of a shift back to stricter measures. So the future is a mix between limited movement to restricted movement to limited movement until there's a treatment or vaccine developed for COVID-19.
Yeah, and we're talking about the next 2 years, yes.
That's a very sobering thought. Dr. Manzanero, just, I know it's still early on, and you pointed out countries that have not engaged in lockdown. We see some of our Caribbean brothers and sisters still taking too long in having strict lockdowns, and they're seeing the impact as well. Just by your own measurement, should we feel secure or breathe a sigh of relief that we're at 2 weeks with no new cases? Or are we doing what we need to do right? Or is it just that there is this disease moving like a malignant tumor that we don't know about, just perhaps waiting to pop its head about again?
I think one is, you mentioned the Oversight Committee. I think the decisions that were taken at that level, we as a Ministry of Health can appreciate them. Yeah. Because we don't make decisions, we advise, and I think Prime Minister and the leader of the opposition who chair that have been very clear that they make the decisions from that first press conference, and I think those decisions have really helped wherever we are with our 18 cases. That's one. Two is, can we breathe a sigh of relief? I would say we can breathe a sigh of relief, but provided we have washed our hands, we have not touched our face, we are keeping our social distancing, yes. And even as you take in a breather, that's like you take a breather before you go out. It's because we are going as a society to face a new norm, if you will. So it's not letting our guards down. Wherever we are right now, it's ensuring we don't go to a second phase, and it's really going to be all contingent on what we do as a community, not necessarily what everybody, the government, Ministry of Health does. It's what we do individually that I think is going to be the hallmark of how successful we continue to be with COVID-19.
Well, we definitely, when you pay attention to what the experts say about the best way to move forward, it's early lockdown will help a lot in flattening the curve, as they say. We didn't really get our curve started that much here, but also test. So that one is completely the Ministry of Health responsibility. Just to throw that out there, and to look at where we see the future going with testing?
Yeah, I mean, we're not shying away from our responsibility. The testing is going to happen. Understand that we as a health system also are now considering how we will go about moving, because there are other things happening. On Saturday, there was World Malaria Day. We can't shy away from the fact that if we do 0 malaria cases this year, we are on the verge of having Belize declared a malaria eliminated country. This week is World Vaccination Week or Vaccination Week. You can't forget all those other vaccine preventable diseases that we have. So COVID-19, even though I think for now it seems to be contingent on what happens, of course, but there are many other health issues that we have to be dealing with on a regular and routine basis. MCH program is going to be started to be lifted up as well, to see if we are not lagging behind with coverage for vaccines in those populations. So it is a lot of work. It's also how we go about doing our health work in a new norm with COVID-19 always going to be in the background.
All right. Well, thank you for joining us and providing all the information that you did. We appreciate you sharing your experience and insight, and of course, look forward to hearing more. Best of luck, Dr. Manzanero.
Thank you.
All right.
Thank you, Doc.
And there you have it. That was the latest update and extended conversation with the Director of Health Services, Dr. Marvin Manzanero, about COVID-19 in Belize. And as he clearly stated in the end, there's always other work that needs to take place. And in Belize, what seems to be in the forefront is, in addition to the COVID-19 pandemic that we're facing, we're seeing a large number of forest fires that are having a devastating effect on the Chiquibu. So we're going to be checking in with the Friends of Conservation and Development to talk to another Manzanero about what's happening there. So please stay tuned.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.